Yeah, good evening, everybody. How you day? How are you? Wherever you're joining me from. The time is 8 p.m. West African time here in Lagos, Nigeria. I don't know where you're watching me from. Today is the 14th of May, 2023, and this is Ask the Doctors. So this program holds every Sunday, 8 p.m. West African time, and we are here again today. I know you might be watching this video after we have ended. Please, in case you do watch this video after we don't end and you send comments and we don't respond, sorry, we've ended the live stream. Do you understand? But right now, I am live, and today we're going to be talking about brain tumors. I can see some people already joining us. We're going to talk about brain tumors. I'm not alone today. So I have my co-host, Dr. Israel, who'll be joining me soon. And we have a guest today that will be talking to us about brain tumors. But before I bring up my guest, he's already in the house. I'm going to bring him up very soon. Tell me, everybody, where are you watching me from? Share the live stream. We have our guest in the house, and I don't want to waste his time. We go straight to the point. So I can see Glory is here. Glory is in the house. Glory, how are you? Ngozi, how are you? Good evening. Osaretin, good evening. Welcome. Yeah, I'm doing good. So tonight we are talking about brain tumors. I go beg you, I beg, share the live stream. Invite your friends. You guys have begged us. You have disturbed us to talk about this topic. And there is no better person to talk about this topic than our guest today. So let me bring up my guest. Uh, okay, let me give you a brief story about him. So he finished from the University of Benin in 2009. He did his internship in the year 2009 2010 at the ERA Specialist Teaching Hospital. And then between the year 2011 to 2013, he worked as a medical officer at General Hospital, Rabat. And then he started his residency in 2013, junior residency in ERA Specialist Teaching Hospital. And 2018, he started his senior residency at the Lagos University Teaching Hospital. And currently, he is a neurosurgery fellow. So he's a doctor that has the license to talk to us about the brain. So, ladies and gentlemen, help me welcome to the platform tonight Dr. Bruno Arekhandia. Chief, good evening, sir.
Good evening. Can you hear me?
I can hear you loud and clear. Good evening.
Good
Good
evening.
evening, Chief. Good evening, sir.
Good
Chief, good
evening,
evening.
sir.
No.
I greet you. I greet you especially.
How are you doing, sir? It's nice to see you here today.
Thank you very much. I'm fine. I'm all right.
Uh, it's an honor to have you here, because I know what it took us. We discussed, me and Dr. Israel, say, can we beg Dr. Bruno to join us today? And he said he will try. So, ladies and gentlemen, we have Dr. Bruno in the house. Chief, please say hello to the people. We have people in Nigeria, people in Greece, people in, I think, France watching us tonight. So, just say hello to them, sir.
Yeah, hello everyone joining the program from Nigeria, Greece, and France. Good evening, all of you, or good day, wherever you
Yeah,
are.
good day. So I have my co-host, Dr. Israel, in the house. So, Chief, we'll be discussing together. Most people have been asking us about brain tumors, and it's not in my place to talk about this. So let's just create this background. What are brain tumors?
Okay, thank you for asking. I'm going to answer your question right away, but let me first say something. The way our bodies are created, well, is this language okay? Or I feel use pidgin?
You use pigeon, I beg. Use pigeon. Use pigeon.
Okay, thank you very much. So you get the one God take create our body when we say He puts mechanisms in place to regulate how body take the grow. So one part of the body no go just start to the grow past as in normally supposed to grow. It they under regulation. So when you have an abnormal population of cells, when they grow uncontrollably, they know they subject to that normal control mechanism when God don't put in place, and it happen inside the brain. That's what they call brain tumors with that. And now what they call heterogeneous entity. different things now make them up, then plenty, and we will talk about them.
You feel you speaking. You feel you speaking.
Okay, thank you very much, sir. Now, Chief, you talk say na heterogeneous entity, meaning say we get different types of brain tumors, or generally when somebody hear brain tumor, you go just say, oh, you get brain tumor, or we get different types of brain tumor.
Yes, now different types, 9 day as I take talk, saying a heterogeneous entity. In fact, over 150 types of brain tumors, 9 day, in terms of the histological types, over 150 types. And now different way if you look at it. Some of them now what they call primary brain tumors. Primary in the sense that now inside brain there, now they arise and then they grow. Then secondary or metastatic, it means say they come from elsewhere. So person if you get tumor for elsewhere, like lung tumor or lung cancer, the thing go enter blood, it go flow, go reach inside brain, it go come out for blood, enter inside brain. You come plant itself like seed, they take the plant inside ground. Then the thing will come they grow. One cell go turn to 2 cells, 2 cells go turn to 4, 4 go turn to 6, until it become a large mass and turn to tumor. If you look at from the other angle, you say, now sometimes these tumors they happen mostly in children, and some of them they happen mostly in adults. So you can have what they call pediatric brain tumors and adult brain tumors. So the first one I first talk now, adult brain tumors, primary and metastatic. And the second one now, pediatric and adult. Other ways they to describe them, but the way I feel just put them now with that.
Thank you, sir. If you just come, welcome. We dey talk about brain tumors tonight, and we get guest Dr. Bruno Arekhandia, a Neurosurgery Fellow, to talk to us about brain tumors. So please, I beg, if you get questions on this topic, just wait. We will take your questions. You understand? So me and Dr. Israel, we could follow Dr. Bruno talk. Now, Chief, I want to ask one question. Brain tumors, how common is they? Now something where they common, because people believe say the only sicknesses where they for this life now your body pain, you dey vomit. But for your own area, how common brain tumor day for we Africans, our region like this over day?
Very good question. But I'm afraid I will disappoint you small because you did ask for the figures for our own area. Unfortunately,
Yes,
we don't get the figures. We don't get the figures. Now, Igbo, now their figures we they use. You know, the reason we say something will happen for village, specific get brain tumor for village, you go meet one private hospital village, then no go follow the matter go reach the end. Sometimes they no go feel make the diagnosis and report them to the relevant agencies. So we don't get the data. However, we go put then let us know, say, out of 100 people when come hospital, when get tumor, inside that 100, 1 or 2 of them are brain tumor, 9 then get. So 100 people when get tumor or different cancer for different type of the body, inside that 100, 1 to 2 of them are brain tumors, 9 then get. That one are mostly for adults. For children, the thing even they a bit more serious because brain tumors they more common in them. For the US, we know that 1 to 5 patients out of every 100,000 children then get brain tumor. Brain tumor for children might be the most common solid tumors for children. Imagine. Of course, you know, say they get leukemia and all of that. Leukemia they are ahead. But when it comes to solid tumors, now brain cancer now common pass. So you can see say the thing they relatively common, especially among children.
Thank you, Chief. Sorry, my mic, I've been mute my mic. Thank you, Chief. We want to ask, what be the risk factor? What be those things when person fit say, when go fit make am think say person fit get this brain tumor?
Okay, very good again. And I'm happy you use the right terminology to ask this question, waiting be the risk factors. Because another person who ask this question, I go say, waiting be the cause, waiting the cause brain cancer, which is a very important thing. It could make you know the cause so that make you feel avoid them. But the truth of the matter be say, as we don't do research reach, we don't know what they really cause brain cancer. Now the risk factors, as the co-host TikTok, now we know risk factors. And you get this agency, International Agency for Research on Cancers. So then help us find out which risk factors they cause they associated with brain cancers, and they help us classify them. So we get the ones when we see them get strong association with brain cancers, you get one we see them get moderate association, and you get one we see them get weak association, but at least that association still there. So as they divide them now, proven risk factors, probable risk factors, and possible risk factors for brain tumors. So proven risk factors. One example now, radiation, which they call ionizing radiation. Sunlight na radiation, but no be ionizing radiation. The X-ray, when they take X-ray pictures for person if you get fracture, and that type na ionizing radiation. So if person dey exposed to that ionizing radiation, especially the one they treat some kind conditions, if you get brain tumor at the end of the day. Let me give one experience, the Israeli experience. During the late 50s, they use radiation, X-ray, to treat children when they get ringworm, when they call tinea capitis. They say they treat them. So fast forward to some 20-something years later, some medical scientists when they find out, say those children, when we see them use X-ray to treat or radiation to treat them, they develop different type of brain tumors, meningiomas especially. So they come right on them. Now, one of the things when make us know say, this ionizing radiation, it gets, they predisposed to brain tumors. Okay. Also, some people when we say them, they around areas when they throw atomic bomb, they usually go end up with brain tumors and different other types of tumors as well. So ionizing radiation are proven risk factor. Then you get the other one again, we say the relationship they moderate, probable risk factor. An example then are viruses. You get one they call Epstein-Barr virus. They usually see that evidence of that virus for people when get the brain tumor they call lymphoma, primary CNS lymphoma. They see them, many of them they see evidence say they don't get that virus before. Then you can't get weak risk factors, possible risk factors. They never too they sure. And an example now, this cell phone they use handsets. They don't do different studies on handsets, whether handset they cause brain tumors, whether they cause brain tumors. The truth of the matter is, say, as at now when they talk, the conclusion is inconclusive. The evidence is limited. But they just put on for mind say if it be like say it cause brain tumors based on some of the studies when they see. But nobody don't really establish and say handsets they cause brain tumor. Waiting they clear, waiting they don't establish, we say handsets, if they use them, they emit radio waves. And that radio waves, now the brain, now they absorb them the most. But whether that effects will end up as brain tumors, now waiting we don't know. So as the matter today is inconclusive. And go good make I finish this matter without talking of smoking. Smoking the risk factor for many kind of tumors like lung cancer. But surprisingly, when it comes to brain tumors, smoking not to get level like that. They don't do many studies and then find out say smoking not to get that relationship. Me say they encourage anybody to smoke because if brain tumor no enter, lung cancer go enter. So avoid smoking generally. The matter be say smoking no get that relationship with brain tumors as it take get for lung cancer.
Thank you, Chief. Make I add this one before we continue. What of family? Because the whole risk factors where you mentioned, touch family, and somebody go and ask us, say, okay, what if say somebody from my family been get brain tumor, brain cancer? Say chance they say me self I fit get them or no chance at all.
Thank you very much. So yes, that is a very important aspect of this segment on the discussion. So let me take a step back. If you want to really look at the bigger picture, we have what we call genetic predisposition. as number 1. Then what they call carcinogens as number 2. And then number 3, secondary tumors. So this one I mentioned now, it falls into the genetic predisposition. In other words, it gets some kind abnormalities when they inside our genes. What be genes? As God tell make us, it puts instructions when go guide the way we want to grow, the way we want to develop, the physical characteristics one will get. It code down, put like code inside gene. So when that gene gets some kind faults like that, it can predispose person to tumors. Sometimes that genes they pass through family, which is what they talk. So there can be a familial predisposition to that. And then what I explained earlier on are those carcinogens. And then lastly, when you have some kind tumors in other areas of the body, like the lung cancer I mentioned before, like breast cancer, like prostate cancer, all those kind of cancer, they feel spread, enter brain.
Thank you so much, Chief. Sorry, my network, I don't understand it. They come and go. Now make they disappear, they reappear. I know say you don't talk so many things, but I want to ask one question. When we talk about tumor, is tumor always equivalent to cancer, or it can be benign, can be malignant? So if it can be benign, anyone there for the brain when it be benign?
Thank you very much. So that one also another way to look at tumors, to classify tumors. Say earlier on I talk say tumor will be primary, the one go start for brain, and if it be metastatic, the one start elsewhere when enter brain. So inside that primary, it can be what they call benign or malignant. Benign and malignant. What benign mean? It's not harmful. Malignant mean wetin? It dey harmful. Now, don't take the meanings literally. Wetin is simply they try to talk. They say those benign tumors, they know they invade the brain the way when malignant tumors they do. They will just they grow, they increase in size, or they cause disturbance as they increase in size. They put pressure on the brain. Whereas the malignant, they will just they will eat inside brain, they invade inside brain, they cause problem. Now, that is one way to look at it, but if you take a step further and look at it in another way, because some people they reason say brain matter, they like any other part of the body. What I just explained now apply to most parts of the body. But the brain means the fact that the brain it inside the skull, which is a tight and limited enclosure. Even that so-called benign, it gets some kind of places when benign tumors will happen, like where they call brainstem, a very sensitive part of the brain. The brain tumor if you start for that area, if it cause the damage, when we say malignant tumor no cause. So we need to bear that in mind if they use those terminologies, benign and malignant. The fact say tumor no dey histologically malignant, no mean say it dey na friendly tumor if it cause problems still. I don't know whether what I explained.
Yes. Makes sense. Yes, I understand.
All right.
Very clear.
All right.
So, Chief, I won't go forward now. Make I ask you question concerning wetin person go see for the body if person gets brain tumor. Wetin be those symptoms? It gets symptoms where say if it appear like this, more na brain tumor dey sabi give this symptom, or you get general symptom wey person if get and it go point to brain tumor. And which one make we no use play? Yes, when we go notice for the symptoms too.
Okay, very good question. Brain tumors, yes, they get signs and symptoms. Wetin be say person go notice for body when go make am go complain give doctor, or wetin doctor go see go dey suspect say this thing fit be brain tumor. Some of the time, those signs and symptoms they no dey wetin oyibo dey call pathognomonic. They fit no give it away, say this person get brain tumor. They fit just suggest. Sometimes you see those signs and symptoms, you go to think say if it be this, if it be that, so you can get them further to arrive at the answer. But at the end of the day, the signs when person fit gets, if it results from tumor when don't they grow, when don't they cause problem for that local area when it dey, or the tumor don't grow, it don't big, they say they cause problem for the entire brain. They increase the pressure for the entire brain. So when the tumor they grow in one specific area, they cause problem for that area. What you will see. Now it's important again to notice say the way go take design the brain is very intriguing. Different location then get different functions when they do, and get different responsibilities and roles. Okay, so you'll get the kind of tumor when go grow for a certain area, you can't they give you sign of say something they happen for this area. You know they perform this role when supposed to they perform. You get the tumor that they call olfactory groove meningioma, for instance. That one they grow for what they call the skull base, where this the brain they sit down for front here. And those wire when they pass enter the nose, when the help person they perceive odor, perceive smell, then they around that area. So if the tumor they grow, they increase in size, go put pressure on those nerves, and the person no go feel they smell things, no feel they perceive odor like before. So and usually in women, this thing they happen, this olfactory groove meningioma. So woman go they cook, food go they burn, you know go feed get jam. So that thing, if it results from any other a lot of other conditions, but something like that, it can give a clue as to say brain cancer or brain tumor day for the background. That same tumor, the area when they grow, now what they call the frontal lobes, the place of the part of the brain when they help you the reason intellectually, like a higher being. Okay, the part of the brain when it helped differentiate adults and children based on the way they behave. So when tumor don't they grow, don't they put pressure on that area, you see person when they say they behave normally before, you can't they behave like say again mental problem. In other words, sometimes brain tumor they feel even present like saying a psychiatric case. You see person they mad, but now brain tumor they put pressure on the area when they help person they reason well. Okay. Another common tumor again, what they call pituitary adenoma or macroadenoma. When we say the area when they grow, now where the wires when they come from the eye, they connect the eye to the brain, they help person they see and they grow. So if this tumor don't grow, it will put pressure on that area and it will disturb the one person they see. Most of the time, they will present with what they call loss of side vision. So they look, so if they look straight, you see they see things when they're your side. For those people, when we say if they get that tumor, they look straight, they see only waiting they straight, they know they see the side. So you see person they drive motor, all of a sudden, bike man go just enter front. You know, go see him when they inside before. Go just see him when they enter front. So another example with that. Then say I've been talking of children. Say children too then get tumors. Usually, most of the tumors when they happen for children, where they call the posterior fossa, the back of the brain, and it's in the day. So it get what they call the cerebellum, the little brain. When we say the work and the function now to help to give you balance, to help fine-tune your movements, to help you move smoothly. When this thing they put pressure on that part of the brain, speaking when don't learn to waka before, you can't the waka, what they call steady gait, if you waka well. Okay. Again, the children will feel they complain of headache. And in fact, say earlier I talk say the brain tumor, if it don't grow to the extent that you can't cause problem when they result from say the pressure inside the brain, the head don't increase, what they call raised intracranial pressure. This headache now one of the problem. So person when get brain tumor, if they get headache, and there's one or two things to notice about this headache when they happen for brain tumor. We say the headache they worse in the night or in the early morning, and if they are associated with vomiting. So person go sleep in the night, headache go wake him up. Go dey feel headache. In the early morning, headache go wake him up. Go dey feel headache. Then you can't feel like say you want vomit. You can't vomit, and then the headache will come relief. you can also note again, say person when they vomit in the early morning, woman when they vomit in the early morning, no be always because of pregnancy, it fit be from brain tumor. Have that at the back of your mind somewhere. Okay, so vomiting and headache, now those are signs of, say, the pressure inside the brain don't they increase. So those are common symptoms when person fit get if you get brain tumor, when we go complain give doctor, and doctor go check, you can't do investigation to arrive at wetin exactly dey worry the person. Others dey when we say I no mention, but we just dey try to cover the main things.
Thank you so much, Chief. You don't mention so many things, and you don't mention so many signs and symptoms when we go notice. One of them a headache, because we know so many people they get headache, and that sometimes they take am likely. But thank you, say let us know, say some headache fit just be say na tumor, na the person get. So investigation, some test when person fit do when the doctor go fit prescribe for person when if you know say problem don dey like that.
Yes, different tests dey when we say person fit take confirm whether brain tumor dey or e no dey. Okay, usually na after doctor don see person, don ask am question, wetin we call history taking, don ask these questions, don find out all these things, don probe, then you come still examine the person, check him body, check him hand, check him leg, check, use different tools, take the knacks, this area and that area, check him eye, check this one. Then you come get suspicion for your mind, say, person fit get brain cancer or brain tumor for this area of the body. So the next thing to do now to confirm whether that brain tumor is true dey or if it be something else. So the test when they do, you get one they call brain CT scan or brain computed tomography scan. So that one, the machine they go put person inside, the thing go create an image of in head, and not just in head, it go create image of inside the brain. So it go fit help us see where problem dey and the type of problem. But even better than CT scan, you get what they call MRI, magnetic resonance imaging, when the office still do. That one they show the image clearer than CT scan. The analogy one they use sometimes now, maybe Nokia 3310. If you take and take snap photo, we compare it to photo when you take iPhone, take snap. Difference there in the quality. And the MRI, they show the tumor clearly, and the CT scan, the two they clear like that. Although it gets new advantage, when some kind tumors, you get some kind tumors when we see a CT scan, and better for them pass. Those when they involve the bone, for instance. So at the end of the day, the doctor can know the tumor when they worry the person. Although that is still not the end of the matter, because after operation, they'll still carry the sample, sent to lab to go do further tests to arrive at the exact tumor when they worry the person. That's just to mention a few of the investigations when they do.
Okay, thank you, Chief. If you just come, welcome. We dey talk about brain tumors, and we get Dr. Bruno in the house, Neurosurgery Fellow. Don't they talk since about brain tumor? If you get question, just dey drop them now. Soon we go take your question. Chief, I want to ask you one question now. After you don't talk about the CT scan, the MRI, most people they fear, say for our country, they know they fit do brain surgery. Say doctors know dey, but for this part of the world wey we dey, help us throw light, maybe to give some people hope, say yes, this thing dey fit do am for our country.
Okay, thank you very much. Say we started from somewhere as Nigerians. Back in the 50s or so, now very few neurosurgeons we get, very couple of them also. Back then, we no get solution as we take get today for brain tumors. But as the years when they go by, they increase in number, to the extent that as at today, there are up to 140, over 140 neurosurgeons in Nigeria. Yes, we know say the number no too, plenty like that. But that small number one get, we see they do something, they do much about brain tumors. If you no go, you no know. If you no go, if you no ask question, you no know. When you go to centers like Lutz, especially teaching hospitals like UBTH, you go find out say many people when they get brain tumors, they come those centers and they investigate them, they find out their problem, they treat them, send their tumors for further testing and send them for further treatment, whether radiotherapy as the case may be. But all of these services, then they are available for Nigeria. Not be until a person travel go abroad. For Nigeria here, they do brain tumors. Week in, week out for hospital like Lutz, for instance, they do brain tumor operation week in and week out. So not be once in a while something, what they do steady. So we get the solution to brain tumors. Granted, there are some difficult ones when we say the expertise no too day like that, but for most of them, we treat them for Nigeria.
Okay, thank you, sir. Dr. Israel will soon go to the comment section. I want to ask one more question before we go comments and take questions. Shey we fit prevent am? E get anything wey I fit do? Say if I do this thing like this, because people go wan see ask us now. We know about other chronic medical conditions, our diabetes, our hypertension. But for brain tumors, e get anything wey person fit talk say if I do this thing like this, brain tumors no go near me?
Again, very good question, because what is the use of this talk if we know if we prevent this brain tumor when they talk about? Now, you will remember, say one of the first questions when you ask now on the risk factors for brain tumors. Yes, granted, we don't know the cause, but we know some of these proven risk factors, most especially the one they call the ionizing radiation. So if we can limit our exposure to ionizing radiation, it may help. It can help. That is the reason why they know they use that ionizing radiation until they treat tinea capitis or ringworm. You remember the story I first tell you when we start. Then they use them again to prevent brain tumors. Again, women when they're pregnant, or small children, they did avoid ionizing radiation generally for them, because the risk of developing tumors, not just brain tumors, other kind of tumors, it did there. Okay, so that's one way when we can prevent it. That one actually they call the primary prevention. But more importantly, the one they more practical, what they call the secondary prevention. And within the secondary prevention, early diagnosis and intervention, early detection and intervention. So the question is how you fit detect them early and intervene. That's another level of prevention. Okay, so if you look at all those symptoms when we talk, once person get that symptom, those day house, they try to manage them, they take paracetamol. Like one man want see one time, if they get severe headache, you see, if they go meet one chemist, they write one medicine for them, ergot, they take that one, they think they calm the headache, but the headache they increase, they go. So when you see those symptoms like that, you go early enough to the doctor, make them evaluate you and determine what you get. And if not brain tumor, they go treat them as the case may be. Okay. Unfortunately, we know they just they carry everybody, go they screen. Just carry somebody, go they do CT, anybody go they do CT scan, say because you want to detect them early, because it's not practical. And there's more harm again than in trying to do CT scan for everybody, because you expose them to radiation, which gets your own side effects. But when these symptoms don't develop and you have a high index of suspicion, we go ahead and investigate them. So that's where the matter changes with that. Wait, before you come in, this one just remind me of one funny story. Okay, so it gets thing happen one time for for Igbo place. You get this man when he get 2 dogs. One day, he just notice say, in dogs, they come they lick in head. They get one particular part of in head above in ear when they come they lick. Any small thing, the dogs will come they lick the area. Just take them serious. After a while, just take them say normal. Like after 2 years, he can't get accident. He can't need to go hospital. Can't go brain head injury get. So they can't do scan for them. And they can't see say, man, say brain tumor get to for that area when those dogs they lick. Say tumor did there. So people don't talk 1 or 2 things about this kind of occurrences. Say some kind dogs they sense some kind tumors for person body, but they never do enough scientific study to take standardize these things. So that one another area of research when we say they feel look into in the future. Is it possible to train animals to recognize this thing early enough and to flag it in one way or the other? It might be possible. Research will tell us at the end of the day. But those are things when we say that they look into.
Thank you very much, sir. You don't talk so many things today. If you just join us, we see they talk on brain tumor, and we get our oga for here when join us, Dr. Bruno, now fellow for neurosurgery. So now join us today. They discuss brain tumor. Sir, one asks, this brain tumor, it gets someone that they feel treat when the person go cure, or they not they feel cure them at all?
Okay, good question. Remember I seen over 150 different types of brain tumors 9 days, so different types. From the one they feel they treat with surgery to the one they say they know they feel they treat them finish. They will just manage them until the person, something happened to the person eventually. So the one those benign types, you get the ones when we say the fit treat them using the different modalities of treatments, which I'm not sure we don't talk about. So surgery day, radiotherapy day, chemotherapy day. In other words, operation day, drugs day, and X-ray treatment. X-ray used for treatment is still there. So you can combine those or use them individually and treat some kind of brain tumors. An example would be meningioma, which is in fact, the commonest type of primary brain tumor. About 1/3 of people when they get 1/3 of primary brain tumor, that's why they call meningioma. Meningioma. You don't hear of meningitis. That part of the body of the brain, when we say with the meninges, when they get the problem of meningitis, a part of it can get that tumor. Okay, so you can do operation, remove the meningioma, remove the place when it arises from, then use X-ray, take finish the rest when they, and most of the time, if you do it like that, the thing will disappear. Then you still get the other one, and that one they call glioblastoma. That one, the ogapatapata, that one bad. Once we see that one, we'll manage them. We'll do the one we do surgery, do radiotherapy, do drugs, and sometimes we can extend life, to over a year. But by and large, the prognosis is very bad. Research still there on ground to find out how they want to take treat that tumor. Research is on.
Thank you, sir. So we get one question, and maybe this person just they come, follow from the beginning. So help us quickly just talk about them again. Say, can smoking cause brain tumor?
Okay. So two things why I pick from that question why I need to dilate on: smoking and cause. Remember, say earlier on in this discussion we talk say we don't know wetin dey cause brain cancer. We don't know. Motor dey cause accident. It no be like that for brain cancer. We don't know exactly wetin dey cause brain cancer, but we know risk factors. Things when we say if dem dey present, there's a high likelihood say that person will fit get brain cancer or fit get brain tumor. And we talk of the different types of risk factor based on the strength of association with brain cancer from the one day strong and to the one day weak. Okay. Unfortunately, well, is it fortunately or unfortunately now? Smoking, make the list. So the relationship between smoking and brain cancer is almost negligible. We no go fit talk say because person dey smoke, he will get brain cancer. No study don demonstrate that one. But smoking dey cause other type of cancers, so like lung cancers. So put that at the back of your mind.
This person say, please, I have a sister having brain tumor. Was glad when I saw this. Please, we need help. What do you mean by help? Talk so we go fit ask our guest here. Okay, so we get question here. It say, please, doctor, is there any age or gender that might mostly be affected with the brain tumor?
Okay, good question. Age and gender. Let me start with age. So brain tumors, e get wetin we dey call bimodal peak. Bimodal peak. Wetin that one mean say e get two different age groups when we say the incidence of brain cancer e dey highest. One na for children and the other one na for elderly people, specifically between 60 to 80 years. So for children and for elderly people, na im you fit see brain cancer. E no mean say no dey worry other people. It can affect any person, but the greatest amount of tumors dey occur within those peaks, children and elderly, 60 to 80 years. Then what about the gender? Unfortunately, brain tumors dey gender bias against males, against men. E dey commoner in men. Okay, but a few ones like this meningioma, I don't talk up to like, I don't refer to like 2 or 3 times now. E dey commoner in females. Otherwise, na males mostly and they get brain tumors.
Okay, we get another one here. It say, please, doctor, for someone to dey forget things, is it part of the symptoms? That is, okay, forgetfulness. If person dey forget things well, shey e dey among the symptoms of brain tumor?
Yes, now among the symptoms of brain tumor, but it is not exclusive to brain tumors. It can be caused by different things. It can be from old age, it can be from different causes. For brain tumors, it gets where the tumor usually go grow. The area when we say they help person with memory. For that area, if the tumor grow, can put pressure on that area, person will they forget things easily. If they form memory. Okay. But if you have somebody in particular in mind when they ask about, you can, try to probe further. That person don't do brain study before for any other thing, you get the kind of drugs when they take, when we say like the drug, they get side effect of forgetfulness, or the person on the old, different kind of things can cause forgetfulness apart from brain tumor. So you have to put everything you have to look at the bigger picture.
Dr. Israel no get comment. Okay, ma, I take this one for here. This person says, please, how can one escape from tumors generally? Hobby had kidney tumor and couldn't survive it. Hey, yeah, so sorry. He says, and I got pregnant during his chemotherapy session. Hope it's not contagious. Sorry for your loss, madam.
Sorry about that one. Sorry about that. But tumors no dey contagious, at least that one the good news. It's not contagious. But how can we escape from tumors generally? Get how. I don't talk of some preventive measures. When we say if you reduce that risk, you can reduce the risk. But to escape totally from that risk, deal. There are researches that are going on to show, say, some of these things when they eat, then they predispose to tumors. You go remember now, recently, they banned Indomie because it contain ethylene oxide. Say the thing they carcinogen, they cause tumor. So imagine, you don't they chop that thing since. If you get on some other food again, when you get those kind of chemicals, when we say they never still ban, when we say they chop regularly, that risk, as long as say we eat processed foods, that risk they there. Okay, as long as say we dey exposed to radiation for one reason or the other, you do CT scan for one reason or the other, those risks there. As long as say something dey inside your gene, when we say your family don't, your parents don't pass down to you, when we say you don't even know, those risks they go everly dey. To reduce Gabada to zero, if it happen, or you can reduce by observing those preventive measures we want to talk about.
Chief, I want to ask one question now concerning treatment. So somebody can tell us saying get person we get brain tumor. So from your own expertise, the two extremes, which one you don't see we say go really collect person money? You get anyone we say when it happen like this one go chop money, or get one say if it happen if you go early, it no go too bad, or generally all of them just cost for the treatment of brain tumors.
Okay, good question. Yes, generally, if person want treat brain tumor, the thing they take money. You no get any treatment for brain tumor when they cheap. You go spend money. It's just that the degrees to which you go spend money they different. Again, I'll fall back to that classification where I use benign and malignant. So some kind benign tumors, when we say only surgery fit take care of. So some kind tumors like that. Once you do surgery, the matter don't finish with that. Sometimes surgery can be curative. But guess some kind types, malignant types, when we say you use surgery to treat them, you go constantly need to use radiotherapy to treat them. You constantly need to use chemotherapy, drugs to treat them. So by the time you put all those different modalities together, and so the price still they increase. And at different doctors you still they see. Okay. And those malignant ones, now then still get that propensity to recur. So you treat them once, after some months or years, you'll come back again. You go start from the scratch again. Sometimes you'll give them further treatment. So you get different grades, of different extent to which you can spend in terms of treating the tumor. And that one mostly will depend on whether benign or malignant tumor, the extent of tumor, or the occurrence of complications. If you treat benign tumor now, you can't go get one complication. Maybe you go get stroke. Person go get stroke, and as they do the operation, when we say to come they treat that one, we come take another money again. So different factors now they decide.
Dr. Israel, I don't know whether Dr. Israel gets anything to ask Chief this night. Dr. Israel, they hear me. You know they hear. Okay. Okay, Chief, I want to ask this question now. Um, when we hear say somebody get brain tumor, I know you told us about benign and malignant. Make we dey for the benign. E get how many years person go say, if this thing dey like this, so okay, money never dey, make I wait 1, 2, 3, 4, 5 years. Make before money go dey, make we go for treatment. Because I know say for this part of the world wey we dey, people no too get money, and the cases wey you don see, you don manage, how dey come? E dey come early or dey come late, or person fit buy time say wait when I get money I go come for treatment.
Your question get many tentacles. So yes, do people usually present late with brain tumors? In this part of the world, unfortunately, yes, there's a tendency to present late with brain tumors. One, because of the poverty when they land, will be low income earning country, or fall in that low and middle income earning country range. So most people not to get money, they live below the poverty line. When they get problems, instead to go see doctor. Some of them will go meet faith healers to help them. By the time when the water don't pass Gary, and they'll come bring and come hospital. And most of the time, it dey very late to do something reasonable. But that no mean say some people see they come early. So some they catch some people early. So some people they fit get another problem. Usually na head injury, get accident, they hit their head. So because of say of the exact injury, we're going to say, okay, let's do scan, let's see whether problem there as a result of this accident for head. You can't go see what you not even prepare for. You'll see a tumor inside, what they call incidentaloma, because you find them incidentally. And usually those kind of tumors, they small, they small. For some of them, especially if na elderly person, so imagine an 80-year-old person now, he gets head injury, then do scan, they can't see one small meningioma. For some of them, you can do what they call masterly inactivity. You go just they observe them from time to time, because we know say for tumor like that, they grow fast. Some people will tell you say they grow for like 3 millimeters per year. So because they grow small. So you go observe and like from year to year, they see the progress. Because surgery gets your own risk. No be say because you see tumor, you just carry the person rush enter theater, say you want to go operate am. Surgery still get your own risk. And some of the time, so tumor when small like that, you can leave it and it no go really cause problem. Again, there are some when you go see, incidentally like that, they don't dey large enough for you to operate on, and you will need to operate on. So the question you ask, you don't get a straightforward answer to it. We treat each tumor individually based on the peculiar characteristics when we see. The general advice when I will give is say, once the diagnosis, they don't make the diagnosis and they don't prescribe treatment, treat it as early as possible. No try to wait and buy time and see whether something will happen. Because if you can't come at the time when don't 2 days late and doctor fit no fit do anything reasonable. Because if get tumor take bad reach, they will talk say we no fit do operation. We no fit do operation. We just do palliative care for this one.
Thank you very much, sir. For those who just dey come abeg, you go need to go watch the video from the beginning, because as we dey try to round up, it's almost an hour right now. Chief don talk about the prevention, few stuff, talk about the signs and symptoms, talk about wetin dey cause am, the risk factors. He mentioned those ones. So abeg, you go try go watch from the beginning again. So as we dey round up, sir, wetin go be your general advice for everybody? Because most times as you don talk and say you no really get wetin person fit do to take prevent, wetin go be your general advice to everybody wey dey lis ten to you with regards to brain tumors?
Okay. So we live in the information age when we say information dey everywhere. Okay. E good make people learn more about their health. People learn more about the different things when fit affect person negatively. Read wide, understand different conditions that can affect people. But at the same time, also get your own doctor, get access to healthcare. When we say if you get some kind complaints, you get some kind problems, you know who to go meet. And I also advise healthcare providers, when they listen to, you are in a position again to refer people appropriately, especially when you pick up signs and symptoms of things like brain tumors. When we say you may not be a specialist to provide that kind of care, but once you don't make the diagnosis, you refer appropriately to the person when need to treat. I dey talk this because just yesterday, you get this particular lady when we say then bring to the hospital. In fact, the family best they had to bring the lady come the hospital. Why? Because the place when they first did, they just try to patch the see the person they want to do. Whereas the person gets symptoms when they suggestive of brain tumor, they no refer, can't give specialist. So in summary, my advice there to people when they listen, know more about your health, get attach yourself to a doctor. When we say you will feel they relate your complaints to, and they'll feel they help you, advise you, and treat you as the case may be. And then to healthcare workers, especially doctors, we will not sabi, we don't know everything. The extent to which we know, let's manage, and what we know, if you know, make we refer to go give specialists.
Wow, we just Dr. Israel, your network they act up since. Okay, Chief, we get one comment here from YouTube because we dey stream live on Facebook, 3 Facebook pages, 2 YouTube pages right now. And somebody they ask us this comment. They say, if a person who get the sickness cannot see with the eyes again, can the eyes be cured? And that is, can the person be seen again, but the person still they talk?
Good question. It will depend on how long the person don't stop to the see, and the extent to which the person they see as at when the person come, and the timeliness of the intervention. Now, I dey talk this because uh, patients when they present with wetin they call pituitary tumor, usually now then they come with this problem with vision. No be say other tumors no fit cause am, other tumors, some tumors fit cause am too. And usually, some of them when they come late, they will come with total blindness, and they will ask, doctor, if you see, after this treatment, if you see. And the unfortunate news be say, most of the time when you treat these people, they know they see again. But some when they lucky, when we say they come with some residual vision, they see small, and the doctor intervene. Sometimes you can restore the vision to some extent. Usually not be 100%, but to some extent. The reason we say the brain is dey unforgiving. The type of tissue when God take make brain, e dey unforgiving. Once e don injure, for am to recover, e dey hard. E no be like tissue like liver now. When you say you get liver injury, the liver will grow back, everything will normal back. For nervous tissue, e no dey like that. So to answer your question, e dey hard to restore the vision most times. But when they come with residual vision and the intervention dey timely, sometimes you can salvage some degree of vision.
Dr. Israel, they hear me? Okay. We get another comment here. Our time, we get less than 5 minutes now as we dey round up. We no wan waste Dr. Bruno time, abeg. He said, please, doctor, can you tell us hospitals in Nigeria where patients can be well treated?
Can you make your question more specific? Well treated for what?
Yeah, okay. So let's say with regard to this topic now, brain tumors. So let's say somebody get person we get brain tumor. Um, Based on your experience, where you know say go here, go here, go here, or general for the whole country.
Okay. So many teaching hospitals for the country, they don't go to the extent we say they don't get neurosurgeons or brain surgeons when we say they'll feel handle brain tumors. But even at that, there are some centers of excellence when we feel handle the bigger type of tumors, the more complicated type of tumors in all over Nigeria. They get for Sokoto, we get for Abuja, we get for Enugu, we get for Lagos, we get for Benin, for UBTH, just to mention a few of them. And usually na the teaching hospitals na we dey talk of. And not to forget some kind private centers too, when we say they don't mature, they don't get services of neurosurgeons, and they don't get also devices and equipment to treat these brain tumors. For Abuja, for Lagos, just to mention a couple of them, then get many of these private hospitals. Some if you dey follow social media, you go know say from time to time some kind of cases they go viral about brain tumors when we say them treat for some of these hospitals. The last one, this Aporoko doctor, when they treat them for one private hospital for Lagos there. So, but if you want to get specific directions, you can contact any of the hosts, and they can also reach out to me or reach out to any neurosurgeon to help out based on the peculiarity of the case when the person gets.
Wow, thank you so much, sir. As in God, this video, I beg everybody where they watch us, help us share these videos to your village people. No fear, share and do nothing they happen. And share to your neighbors, your community. This video they very, 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 very rich. And one thank to people who send us stars and Dr. Lawal. We get Dr. Lawal in our midst from AAU. Dr. Lawal is here, and then Ngozi Amina. Thank you so much. Dr. Israel, did you hear me? Any final words as we round up this night? Anything we want to ask our guy in the house? You know they hear me. Okay. So, sir, I want to say a very, very big thank you to you for honoring us tonight, for taking out your time. We know how busy you did, and you decide to come spend 1 hour with us tonight. We say a very, very big thank you
Okay.
to you.
Sorry, say my network they go. I dey hear you. Sorry.
The network they mess up tonight, so we know go few ways. Sir, any just final words as we disappear. Thank you, sir. Final words.
Final words. I think we don't talk everything we need to talk. Today na Mother's Day. If you never call your mother, call your mother and wish your mother happy Mother's Day.
Yes, yes. Thank you very much, sir. Thank you very much.
Okay, Dr. Fred.
Oh my
All right.
God. Yeah, thank you, sir. Chief, thank you so much, and
All
have a
right.
wonderful night. Thank you
Thank you
very,
very
very
much.
much, sir.
All right.
Good night.
Good.
Dr. Israel, sorry, your network messed up. I can't hear you. Ladies and gentlemen, thank you so much for honoring us tonight. We appreciate every one of you. We don't take this for granted at all. Please, this program is 8 p.m. every Sunday. So if you come late, you go miss. And when it's 9 on the dot, they stop the program. We know they like talk and talk, they go like that. Thank you, and we'll see you. Remember, good life in a sense. Ngozi, thank you for the stars. Lawal, thank you for the stars. I really do appreciate. God bless you all. Thank you very, very much. And this video makes sense. So
Okay, thank you.
it will make brain. Thank you, guys. Bye bye, and have a wonderful night. Goodbye. Au revoir.